before I use any alcohol,
You prefer vertical?
Whichever is fine. Whichever is fine.
Alexander, just with IV, just set it up.
Just set it up.
Time to connect it.
Okay. Do I set up this?
Yeah.
Yeah. Okay.
Yeah, just set that part up. Just set your IVs up, don't try to connect it.
Okay. You started? Okay. Right now I'm just verifying all the healthcare providers' orders. I'm getting her IV line ready and set up. I'm gonna be giving her vancomycin. We're giving her 2 grams, I believe. I just clamp the line. I have her vancomycin ready to go here. Let me just get. This is all going into the sharps container. Today I'm going to be doing an NG tube insertion on the patient.
Alright, can you please identify your name and date of birth?
Right, so this patient is,
Okay, so I'm gonna wait for this to dry.
he's a 44-year-old male. He's a 44-year-old male with abdominal distension and vomiting. And today I'm going to be just putting in an NG tube. And I just gave them vancomycin 1 gram via IV piggyback, and we're going to be doing that every 12 hours. So I'm just
today
gonna
I'm going
no.
to be doing trachea. First, I'm going to
provide some privacy.
for 10 minutes of regular insulin, as well as some
Hello, my name is Alexandra Rodriguez. I'm going to be your nurse today. Can you please tell me your name and date of birth?
on your lower abdomen.
Okay, perfect. And do you have any allergies I should be aware of? No, perfect. All right, I'm just going to raise the bed here a little bit so I can get to a little bit more of a comfortable height.
The tubing as well.
Okay, so today basically what we're going to be doing is we're going to be putting in an NG tube. Is that okay with you? All right, perfect. I'm just going to have you swallow throughout the procedure so we can make it go a little bit easier for you. And I'm going to check out some things beforehand. Let me just get everything ready to go and set up here, okay? Just setting up my tape. This is just a clean procedure, so no need to worry. Doesn't have to be sterile or anything like that, okay? Okay. So, just get started here. Now that you're already in a high Fowler's position, we're gonna get started.
Sorry about that. It gets a little sensitive. Okay, now that it's all put down, I am going to
Just pouring the lubricant now, so we can have everything ready to go.
I'm going to be placing this over. It's going to hold down your port. And now I am going to be doing your trachea.
Just throw this over here.
I'm going to take out all of the old stuff. I'm going to throw it in trash, and then I'm going to do it again, if you're experiencing any discomfort,
Okay, so I'm just gonna listen to your abdomen really quickly for any bowel sounds, because if we don't have any, we can't put it in, all right?
okay, now I'm going to
Just move this a little bit forward. I'm gonna lift here, okay?
I'm going to throw this away. Okay. And so now I'm just going to be writing.
You have bowel sounds in all 4 quadrants, okay? So we're just gonna get started.
Okay, fine.
Can you cough for me? Perfect. Thank you so much. Now I'm just going to be assessing you for your gag reflex. I know it's a little bit uncomfortable, but we just have to make sure, okay? So I'm going to put it in. Okay,
and
perfect. Thank you.
It's for your CVT dressing. Now I'm going to be doing, I checked your MAR. And have
I'm gonna close your nose here, and I want you to breathe out through one. Okay, and through out the other. Okay, I'm gonna be using this nose since it's a lot more patent than the other. All right. I'm gonna get this.
I'm gonna raise the bed a little bit. I'm gonna be using gloves that are my size. I'm gonna lower the rail. Okay, and I'm gonna get a new pair.
Okay, I'm just gonna measure from the tip of your nose to your ear to your xiphoid process. Okay.
Now I can listen.
So I'll mark that here with my pen.
So I can clean that.
I put it inside of the bedside table and this will.
I'm sorry. Okay.
So I'm just gonna put the lubricant on
Yeah,
the
I'll bring
NG
my laptop.
tube.
Okay, I'm done with the now I'm going to give you your heparin. Sorry about that. I'm gonna close the courtesy again.
Okay. Your pulse ox looks good. I took your vital signs beforehand. I got your blood pressure, your heart rate, your temperature, and all your vital signs are normal. So we're gonna start and go ahead with the procedure, okay? So I'm gonna put this in your nose, gonna aim it to your ear, and I want you to put your head down as I'm putting it in, okay? Alrighty. And just swallow whenever I tell you to, okay?
Just a slight
Okay.
pinch.
Can you swallow? Swallow. 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 Swallow.
I'm gonna be
Okay, I'm 25 to 30 centimeters in, so I'm just gonna assess for air. There's no air sounds, so that means we're in the right track. Keep going, keep advancing it. Keep advancing the tube. Just keep swallowing for me. There you go. I know it's uncomfortable. I'm so sorry. Bear with me, okay? Keep swallowing.
Okay, just wanna make sure we clean it.
I'm gonna pull out a little bit because it got a little coiled, all right?
Now I'm gonna clean it. And I'm gonna pinch your skin, and you are gonna feel just a slight little pinch.
Just a little bit more, and we're almost done, okay?
Okay.
Oh, yeah.
Right. This is gonna be in your abdomen or in your.
Okay, perfect. It's all the way in, all right?
All right, there we go.
I'm just gonna temporarily tape this to your cheek here, okay? While I check to see if we're in the right spot.
Lightly down, not press too hard. Okay. I'm gonna clean the outside first. Now I'm just gonna dispose of this in the sharp container. Okay, I'm gonna clean it and I'll put your gown back up for you. Now this hand is non-sterile. Is everything okay? Is the dressing okay? Comfortable?
Okay. I'm just going to aspirate a little bit of stomach contents to make sure that we're in the right place, okay?
And would you like to be seated back up? Okay, I'll put you back in the sitting position as soon as I lower you.
I'm gonna aspirate around 30 mils.
Now, before I go, do you have any questions, any concerns? Okay, well, that is everything for today. So if you need me, your call light is right here next to your bed, okay? And I'm going to answer any questions.
Let's clamp that. I'm gonna pour it in here. Okay. I get a pH strip.
I'm going to try it.
Okay, so it's a yellowish color, and that means that the pH is below 5, so we're in the right area, okay? Now I'm just going to get this tape here, and tape it to your nose. I'm going to wrap this part around right there on the tube, okay? You feeling okay? Let me know if you need anything, okay?
The big gloves after you even brought these.
Huh?
You use the big gloves on you even if you
I know, because I just bought that just in case anything happens.
Okay, I'm just gonna tape this to your gown here so that it doesn't move or anything like that. Okay, I'm gonna put this in the biohazard bag. Close this. This is gonna go in my sharps container. Now I'm going to just check the back of your throat to make sure we're in the right place, okay? Make sure there's no coiling back there or anything like that. Okay, I don't see any coiling. Everything looks like it's good. It's going straight down. It's in the right place. So now I'm gonna leave it clamped so that nobody puts anything in because we still you have to do an x-ray to make sure that it's in the right location, all right? Let me throw this away.
So first,
I'm gonna go throw this away in my sharps container really quick.
make sure that everything
Okay, I'm gonna throw everything here away. All this is gonna go in the trash here.
then I'm gonna bring it around your head.
So, are you in a comfortable position? I'm just gonna lower here a little bit for you, okay? So you can be a little bit more comfortable. Let me know. That's good? Okay, perfect. Here's all your personal belongings and everything near you. I'm just gonna double check your order here for your meds and then I'll be out of your way. Okay, we have 1 gram IV piggyback every hour. We inserted 1 gram here into your IV piggyback. And let me just get a tubing for your saline to keep your vein open once the piggyback is done. Okay, I'm just gonna put in your IV tubing now. I have it all set up here, but I just want to make sure that we keep the normal saline running as well, so that way I get an alcohol swab that I don't have. Just gonna clean here, make sure everything's clean. We don't want to cause any sort of infection. Sorry about that. Just wanted to make sure that we have that vein and keep it open. Okay, that's clamped. Okay, that's good. These are both clamped.
Okay, I'm gonna put your If you have any questions, please let me know.
Clean with alcohol. And that is good.
And are you comfortable?
Just get some paper to clean up here what I did. And I'll be right back so I can prime the line and get everything set up for you.
I'll be out. Thank you.
I just put on a clean pair of gloves, okay, so we can make this as clean as possible. Okay. your gloves here. So I'm just gonna bring the trash can over really quick so I can prime the line. Make sure there's no bubbles in there. Okay, perfect. I don't see any bubbles here. There are a few here, so let me just get that sorted. The line has no more bubbles and it's primed, so we're going to close this up right here real quick. Throw away all that extra stuff that we don't need. So we're going to give you 1 gram IV piggyback every 12 hours, okay? So we did from a bag of vancomycin that had 500 milligrams, we got 2 grams, 1 gram from that. So we're just going to put this in now. Okay, just got to connect this to your line.
I don't know. Like, I'm not worried about it.
Alrighty, well, I think that's everything, okay? I put in your NG tube, I gave you your medicine. Please let me know if you need anything else at all, alright? I'll be outside, okay? Thank you so much. I'm just going to perform hand hygiene.
Well, if you're gonna inject it, yeah.